Hey guys, it's Dr. Baker. I've had a lot of people ask me to list at least the 5 things that I wouldn't do as a neurosurgeon. So this was a real tough one because there are so many things I wouldn't do personally. So I kind of categorize them into big 5 categories. I would never ignore your body's signal. Remember, pain is a God-given signal to protect us. So if something's hurting, there was a reason for that. So I would follow that reason. I've had a patient who had weakness that developed at night, and he was on a blood thinner. His legs were weak, and he just thought he would just sleep it over. And by the time he woke up, he was paralyzed. He was on blood thinner. He had compression of his spinal cord. And by the time he got that decompressed, it was too late, so he lost function. So never ignore your body's signal. By the same token, if you have any numbness and tingling, that could be a sign of spinal cord compression, stroke, tumor, you name it, anything. Don't ignore that. Second big category is don't use Dr. Google for your diagnosis and treatment. I've had so many patients and followers who ask me questions based on their response they get from Google search. So you need a qualified neurosurgeon or a physician, depending on what the problem is, to diagnose and treat the problem instead of going online and diagnosing and self-treating your problem without really knowing the good and the bad sides of these treatments. Third big category is avoid high-risk behavior. Now, there are 2 separate sections to that. I'm going to focus on one main one here, which is trauma. Anything that puts you at risk for trauma, like head injury, not wearing helmet while riding your motorcycle or an ATV, for jumping into a shallow pool where you're at risk of what's called hyperextension injury, where your neck abruptly turns backward because you hit your head and your neck either breaks or compresses the spinal cord in a severe fashion, which could result in paralysis. But that's not it. I mean, anything that you think would put you in harm's way, I would avoid in terms of trauma. Fourth big category is somewhat related to the third one. It's related to high-risk behavior. And I put using drugs, smoking, alcohol use in that category. Obviously, drug use, I'm not here to, promote drug use. There are all kinds of different drugs, and my personal philosophy is avoid them altogether if they're not benefiting you in any way. Smoking, the effects of smoking are just well known, and it actually directly impacts the patients on whom I do spine surgeries on. They have worse outcomes, patients who smoke compared to patients who don't. Alcohol, in the past, they used to say 1 glass of wine was good for you, but evidence is very clear, and especially in my field as a neurosurgeon, we know that given the small amount of alcohol patients consume can have a negative effect on the brain. It's considered a neurotoxin, and we know that brain shrinks in patients who drink alcohol, so avoid it altogether if I were you. And last point is don't believe in everything you hear. Especially on social media, there are all kinds of influencers out there. In order to get more followers, they come up with really very, very broad and misleading statements that they give, and non-scientific explanation. I just would be very careful before jumping to any conclusion without using science as your guide.